everyone. I am Marl Lozano, studying Bachelor of Science in Nursing at ISPSC Main Campus, and today I'll be performing the Thorax and Lungs assessment. First is the assessment. I should identify the patient, determine patient's level of consciousness, primary language, and literacy level. Sir, ano yung name mo?
Malanda ang Lozano po.
And taga no ka, sir?
Centro Surigao.
Kaano ti birthday po, sir?
March 8, 2014 po.
After asking patient's name using at least 2 identifiers, we should check the EHR for history of lung disease, chest trauma, and for the vital signs. After checking, we should assess history of tobacco or marijuana use. And if patient has stopped smoking, we should determine the length of time in which patient has stopped. And if patient uses vape, we should determine the device type, the flavor, preference, and the mix of tobacco products being used. And after that, we should ask if patient experiences a persistent cough, sputum production, chest pain, worsening shortness of breath, a hoarse voice, orthopnea, dyspnea during excretion, activity intolerance, or current bouts of pneumonia or bronchitis. Sir, dabati kwa, tinapalpalabas nga aldaw, sir, or idikas ladi na minsan, sir, agay uyok ka ba? Adabati parang, nasakit ba ti kasto mo, sir? And, kasla, adabati, naaganos ka, sir, ket, na, kasama ti panaganos mo, sir, normal laing ba? And, kasla, no, kumasir dati ubraem kuma, kunyari, agjag-jogging ka kuma, sir. Napaspas ka ba nga mabannog or haan? Haan ba, sir? And, adabati parang, na-diagnose ka ba, sir, nga dati asthma, bronchitis, sir? After asking those questions, we should determine if patient lived or worked in an environment containing pollutants and if the place requires exposure to radiation. Sir, di pagyagyan ket adaba parang narugit ba, polluted ba? Kasi ano di angin, sir? Nalinis ba di angin nga sulsud ulit, sir? Kasi numat, sir, no, jay, kunyari, di danom, sir, kapag digdigos mo, nadalus ba? Kaya jay kanim, sir, kit kita emet lang, kasi ano, jay luto na, sir, jay, ba, balayo nga luto na dagay makan, nalinis ba, sir? Okay. After asking those questions, we should review patient's history for known or suspected HIV or human immunodeficiency virus infection, and determine risk factors for TB. And after that, consider natin na we reviewed patient's history on patient's EHR as parang wala naman siyang history, so there are no records of infections on HIV and any factors requiring positive for the TB test. And after that, I should ask patient when they had their last TB test, tuberculosis or tuberculin test. Sir, ito yung EHR mo, sir, ket makita met nga idi last July last year kamot nga nagpatiga ka, sir, negative mat, sir. And after that, I should ask if patient had history of persistent cough, hemoptysis, unexplained weight loss, fatigue, night sweats, and or after that, I should determine if patients has any history of chronic hoarseness. And I should assess history for allergies like to pollen, dust, or to other airborne irritants and to any foods, drugs, or chemical substances. And after that, I should determine if patient has any history of severe allergic reaction. Sir, ada ba ti allergies mo, sir? Kas makita kita EHR mo, sir, ket ada ti allergies mo iti peanuts, eggs, and shrimps, sir. So, agajay, sir, kat parang as much as possible, iwasan tapnuhaan kan agas nga agas rin niya para iti allergies. And after that, I should review family history for cancer, TB, allergies, asthma, bronchitis, or emphysema. And after that, last but not the least, I should assess patients' knowledge, prior experience with chest examinations, and risk factors for lung problems and feelings about procedure. Sir, among ba ato yung thorax and lungs nga assessment nga kung kunada? Sir, napadpadasan ba hinap na pa ng mga hospital? Sir, so tata, iso ti obraen tayo kanyam niya, sir, tap no ma-assess no adaba, kunyari normal ba? Iti lungs, chest, panagangas, kasi niya, sir, kaya no man, parang da makita tayo nga abnormal or irregularities, sir, kat mabalin tayo nga may report. Yes, sir. After the assessment, is the planning. I should determine expected outcomes following the completion of the procedure. And I should also explain the procedure to the patient. So, ato yung obrain tayo ata circuit, mang-assess or mang-tulong ka nga yung maamuan no, normal ba iti condition iti barayo sir niya kenti panagangas nin ken no adaman iti parang maamuan tayo nga irregularities or abnormal or dihangan normal niya sir ket mai-report tayo ken ma-actionan sigod. And after explaining, I should anticipate topics to teach patient during examination, and I should also perform hand hygiene and prepare necessary supplies at bedside. And after that, I should close the room doors and or bedside curtains, and I should position the patient sitting upright. For bed ridden patient, I should elevate the head of bed up to 45 to 90 degrees, and when unable to tolerate sitting, use supine and side-lying positions. Next is the implementation. I should remove patient's gown or drape from the posterior chest and keep front of chest and legs covered. And as examination progresses, I should remove gown on areas being examined. Ngayon makita tayo mat kini patient ken nakatugaw, haan met iso na bedridden, ken haan met iso na nga nakaida. So nga haanin masapol nga i-position iso na. Pero i-astela ta if comfortable ni patient. Sir, okay lang ba if nakatugaw ka, sir? Comfortable ka mat lang? Okay, sir. And after that, I should explain all steps of the procedure, and I should encourage the patient to relax and breathe normally. Sir, breathe normally with their mouth or using their mouth. Sir, ato ikat na-explain ko matatay na sir amin ng procedure. Ato ikat damagit to kanyam na mabalin ka igaman or mabalin ko ba nga parang kahit bati at ay mabalin na ba nga ag-health teaching kanyam. Yes sir, dumawat na lang ti parang consent or pamalugos niya sir. Okay lang ba agi kanyam sir? And after that, we'll be now examining the posterior thorax. I'll be now examining patient's posterior thorax. If possible, I should stand behind patient and inspect thorax for shape and symmetry, and of course the anteroposterior diameter. So yung thorax is the area between the neck and the abdomen. So dito tayo sa likod ni patient mag-assess and umangas ka na sir. And we should determine rate and rhythm of patient's breathing and examine thorax as a whole and have patient relax. Sir, relax ka lang sir and umangas ka sir. We should inspect and while determining, we should systematically palpate posterior chest wall, costal spaces, and the ICS or the intercostal spaces. And when patient voice for pain or tenderness, we should avoid deep palpation. And when there is a presence of suspicious mass, we should palpate lightly for shape, size, and the quality of lesions. Sige sir, umangas ko. Ibagam no na sakit sir ah. Awan mati na sakit sir. And now we should assess chest expansion, noting movement and symmetry. So we should put our hands like this. Sir, mangas ka man sir. Paisa. So patient's breathing is normal and the expansion of patient's chest is normal, and we should note that. And now we'll be auscultating patient's breath sounds. And we should now listen to entire inspiration and expiration at each stethoscope position. And when sounds were faint or are faint, we should ask patient to breathe harder and faster. And now we'll be comparing breath sounds over right and left sides, and listen for normal and adventitious sounds. Okay, so umangas na ulit sir. Sige sir. Umangas pa sir. Umangas ka lang sir. When auscultating adventitious sounds, ask patient to cough and listen again with stethoscope to determine if sounds are clear with coughing. Aguyok ka man, sir? Aguyok, sir. Aguyok. Sige, tayo, sir. Okay, sir. I will be assessing patient's lateral thorax. We should instruct patient to raise arms and inspect chest wall for same characteristics as reviewed for posterior chest. And we should now extend palpation and auscultation of posterior thorax to lateral sides of chest except for excursion measurement. Sir, okay lang ihalta iwas. Okay lang ihapag, sir, ha? Sige, sir. Mangas ka lang, sir. Dala-diretso. Mangas na unod, diretso. Dala-diretso, sir. Mangas, sir. Okay, sir. Di bangin. Mangas na unod. Sabay. Sabay. Okay, sir. After assessing patient's lateral thorax or inspecting patient's lateral thorax, we should now move to the patient's anterior thorax. And for the anterior thorax, we should inspect accessory muscles while patient is breathing and note effort for patient's breathing. So, inote natin yung effort, and also we should inspect width or spread of the costal angle made up of costal margins and the tip of the sternum. And observe patient's breathing pattern, observe symmetry and degree of chest wall and abdominal movement. Relax ka lang, sir. Relax. Hindi. I-relax na. Basta. Sige, up, chest up. Mangas ka, sir. Inhale, exhale. Inhale, exhale. Inhale. And we should also listen to we should also palpate anterior thoracic muscles and ribs for lumps, masses, tenderness, or unusual movement, and follow a systematic pattern across and down. Relax. Mangus. Inhale, exhale, sir. Hand ka nga stop ng mangus, sir. Inhale, exhale lang. Sige, sige. Diretso lang. Thank you. And last but not the least, we should palpate anterior chest excursion and noting symmetry. While palpating, we should note if there are presence of mass, lumps, and tenderness on patient's ribs. So wala naman, normal naman po. Wala namang enlargement and everything. Mangas ka naman yung sensor. Okay. And the symmetry, it is normal. Thank you, sir. And now we'll be cleaning the stethoscope, and we should store it, and we will now proceed to the next examination or help the patient to a comfortable position and perform hand hygiene. After performing hand hygiene, I should place the nurse call system in accessible location within patient's reach, and I should raise side rails and lower the bed into lowest position, locking into position. And for the evaluation, I should compare the respiratory findings with normal assessment characteristics or the previous assessments for the thorax and lungs, and have patient identify own risk factors and those factors leading to lung diseases. And I should use stitch back revised instructions if patient or the family caregivers cannot stitch back correctly. For documentation, I should document patient's respiratory rate and characteristics, or the character, breath sounds, change note after coughing, chest excursion, and other physical assessment findings. And I should also document the evaluation of the patient and the family caregiver learning. And for the handoff reporting, I should report abnormalities immediately to the healthcare provider.